All right, we're back with you on a magnificent Monday, and that is what we're speaking into it. That's what we want for you. But thank you so much for sharing these early hours with us. And as mentioned in our opening spiel, we will be discussing with Dr. Andrew Ford, our dermatologist, the dermatoses of pregnancy. There are various types, but I think from based on what Dr. Ford pointed out earlier, it's not very common. Good morning, Dr.
Good
Ford.
morning to you and
Morning,
to the
morning.
viewers
Yes.
once again.
So what exactly is it?
Well, dermatoses of pregnancy refer to some very itchy inflammatory conditions that are specific to pregnancy. A pregnant individual is entitled to have any skin disorder that anyone else would have, as well as the physiological changes. But the polymorphic eruption of pregnancy is one of them. That one, yes, that's one. Then there's one that involves blistering. Then there's one that involves the liver, that's called intrahepatic cholestasis. And then there's another one which also involves atopy or sensitivities to the environment. So there are quite a few, but we do know that usually individuals that are pregnant might put on a little weight and get darker areas around the abdomen and the areola. And we also know the veins may get bigger, you may grow skin tags or what Bajans call moles, and various different things happen that are physiological. But these are specific things for pregnant individuals.
But are women more susceptible to these things during pregnancy?
Yes, they only occur during pregnancy. Yes,
Do
definitely.
they then go away?
Yes,
nicely
most of them
after?
go away after, but some of them can recur in subsequent pregnancies.
Well, I got to ask you this because, you know, you talk to women these days and the biggest concern are stretch marks. Is that one of the conditions?
That's one of the physiological changes. The skin is being stretched rapidly, and the collagen and the tissues underneath the skin just split. So that is one of the things that happens, and it occurs in the abdomen most of all. But depending on how much weight they put on, then you can have these marks, which remain in different forms, just discolorations. Usually they get lighter. Initially they're darker in the darker skin types.
Okay, so break it down for us. Why exactly do the dermatoses of pregnancy happen? Why exactly is it hormonal?
Well, in some cases they know, and some of them are immunological, but they just occur that way. For example, the first one, the polymorphic eruption of pregnancy, in that individual one.
Is this what we're looking at?
Yes, this is a polymorphic eruption of pregnancy. It's characterized by spearing around the navel, but then where the stretch marks are start to get swollen, and you get little bumps and things that look like urticated or hived bumps and plaques that get red, and they itch a lot, and it spreads to the back and the arms and the legs. And this is something that occurs in the late stages of pregnancy. It occurs in women who've just had their first child, or if you're having twins or triplets, it can also happen, but it occurs later in pregnancy. It isn't dangerous, but it does itch a lot.
Okay, this what are we looking at here? This is the same thing?
Yes, this is the same polymorphic eruption of pregnancy. It's also called pruritic urticated papules and plaques of pregnancy, and that really describes the bumps and the swollen areas that look red and irritated. So in a Caucasian skin, it's very red and looks inflamed. So this is the legs of someone with that condition. And this is the arm, so it shows you it can affect different areas. But the face and the mucous membranes are spared, but it causes these inflammatory looking changes. And it is disturbing to women, but the most important thing is to treat the symptoms, to let them understand that it will go away as soon as you deliver or soon after. So in the meantime, we do things to cut down the symptoms that the ladies will
what?
notice.
Because there's so many things you
anti-itch
can't do
medicines
when you're
and
pregnant.
Rabon medications, anti-inflammatory medications. So this is in the darker skin type, just to show that the navel is spared again, but on the right, in the lower right-hand corner, you can see where the stretch marks are. They look very swollen and irritated.
And this is someone of a black skin?
Yes.
Okay, so is it more prevalent in a particular race, or not necessarily?
No, it isn't more prevalent. It occurs in about 1 in every 160 pregnancies in general. But that is the one that you see most commonly in Barbados. I would say that at least once or twice a year you'd see a patient with that condition. So usually the obstetrician would send them, or the patient would come of their own accord.
Okay.
What impact, if any, does these conditions have on the unborn child?
Well, in the case of the one we just looked at, none. But the one that comes next, which is the blistering form.
And it may seem a little graphic to you.
Yeah, the blistering form can have some effects on the baby. Again, this one affects the navel and the abdomen, but it can also affect the trunk and the arms and the legs. But the bumps and the swollen areas and the plaques can turn into these tense blisters.
This could be, that would be very alarming to
Yes,
someone.
because this one occurs only 1 in 50 to 60,000 cases, and in
Wow.
18 years I've just seen one patient with it, and they're the photos from that one patient. So again, it occurs late in pregnancy. This one is extremely itchy, and the thing is that in this case, this is the young lady too, and you see it's affecting it around the navel as well. In this case, you can have problems with the placenta, and you can have an earlier birth, or the baby may be slightly underweight, and this can occur in subsequent pregnancies or with use of birth control, or sometimes with your regular period. So someone with this one has to be monitored by all the specialists, the obstetricians, the dermatologists, and everyone else. So this is one of the ones that
real
will
challenging
be,
ones.
yeah.
Wow.
And in this one, you may need oral steroids as well, which is something that you don't usually use in the pregnant female. But the itching is intractable, and it's worse at night, and people, you know, they really want to get rid of the itching.
Is there any repetition of these conditions outside of pregnancy if you've had them once?
No, these are not, this classification of dermatoses of pregnancy are very specific, except for the cases where there's an atopic type, where the individual has a history or family history of asthma or eczema, and that individual can display eczema just like anyone else, or they can display what looks like acne on the chest or the back, or sometimes on the face. That's a follicular form. So in that case, the person may have eczema or other atopic conditions as well. There is also another one which is called the intrahepatic cholestasis. What that means is that inside the liver, the bile doesn't flow, and this individual looks perfect, but they just itch a lot at night, and all of the marks on their skin are just from self-imposed scratching and that sort of thing. And if they do it enough, they can develop bumps and swellings. I seem to be affecting you today, Doug.
Yeah,
Yeah.
just the
Talking
thought,
about it.
just the thought of all of this itching. And
I
not
have,
being
I have
able
to
do anything,
apologize.
you know.
But in that one also, the females can become jaundiced, and sometimes some of their blood tests for the liver or for bile or for other things can be deranged. But that one, you know, all of them go away when you deliver. So, I mean, the good news is that they're only specific for pregnancy.
Okay.
And they're not life-threatening for the female. They are just kind of, you know, uncomfortable.
Yeah, but how do you deal with those challenges and not have any impact on your long-term health and the baby?
Because I'm worried about the medication.
We only use medication that can be used in pregnancy. So the antihistamines, maybe like Histal. Sometimes you can use something called cetirizine or loratadine. Since they occur later in pregnancy, the use of the steroids orally won't affect the baby as much as in the early stages, because sometimes when babies are premature, the doctor will actually give the mother a type of a steroid treatment in order to make the lungs develop quicker. So the thing is, you want to keep the mother in good shape. You don't want it to be uncomfortable, and you know that way it makes sure that the baby is in the best shape possible. In the blistering form, sometimes the baby can come up with blisters, but this is just something that lasts for a short while and then goes away, and the baby is totally normal after.
How early in the pregnancy do you see manifestations of these
Yeah,
issues?
in most cases, in 3 of the cases, they're in the middle or the late trimester. But in the case of the intrahepatic cholestasis, that can occur a bit earlier.
He has lots of questions about this.
Yeah, he's
kinda
interested
curious.
in this group.
Wow.
You go ahead.
Okay. No, that's fine. We're going to take a short break, and then we'll continue our conversation with Dr. Andrew Ford, our dermatologist. And if you have questions, feel free to call us at 228-5562 or 228-5563. We'll continue in a moment. back with you. And yes, Doug has got jokes this morning. He has definitely he's got you laughing, right, Dr.
the
Ford?
quill.
That's good. Laugh a little. If you haven't laughed yet
laugh.
for the morning,
That's the best medicine.
yes, you need to laugh. That is, I believe, the best medicine. But we're continuing to look at dermatoses of pregnancy and other conditions. So one of the things that people sometimes, I don't think everybody has that, but something people refer to commonly as the mask of pregnancy. What is that?
Yeah. The mask of pregnancy is called melasma or cloasma, and it actually refers to increasing pigmentation on the curves of the face. So it occurs on the forehead, on the cheeks, above the lip, and other places. So with time during the pregnancy, the pregnant lady gets darker in those areas. In most cases, it goes away, but some people can have a residual effect after pregnancy. And in the non-pregnant female, then things like taking the contraceptive pill or being in the sun a lot can then reactivate it. And it can be something that's seasonal, especially in northern climates where you get the seasons. In summer, people have it more, and then it goes away.
In winter.
What about a darkened neck?
Well,
Does
a
that have
darkened neck.
anything to do with
Yes,
that?
well, that can happen too, but that's due to the weight gain, and sometimes you can get something that's called acanthosis nigricans. That's really refers to.
Pardon?
Yes, it's if you gain enough weight, you can get the folds of the skin getting darker, and you get these little growths in the folds that are called skin tags. So you know, some people get bigger with pregnancy, and then afterwards, some people remain big.
Right.
So that can sometimes be a hint of insulin resistance or just being overweight.
So
So
then
it looks
that's
as
not
though your
limited
neck
to
needs
pregnant
scrubbing, but
people.
it doesn't need scrubbing. Scrubbing doesn't get it all.
That's not limited to pregnant people then.
Oh, okay. So
No,
what about treatment for some of these kind of conditions? Because, you know, ladies, at the slightest infirmity of the features, you know, they want to.
Well, most
By a new face.
treatments during pregnancy are kind of left until after delivery. Even though there are some treatments that are safe during pregnancy, a lot of individuals during pregnancy also can get acne, and most of the treatments are just rub on, like benzoyl peroxide and that sort of thing. But the important thing is the passenger, which is the baby, and also the vessel, which is the mother. So anything that can be left till later, we leave till later.
What are your thoughts on things like hair dyes and relaxers during pregnancy?
Well, most of the time they can be performed and nothing will happen. Actually, during pregnancy, you find that the hair grows luxuriantly. Your hair grows incredibly well when you're pregnant. But then after, like 3 months after, you find that you have a hair fall and you lose a lot of the hair because the growth phase switches then to the dropout phase.
Yeah,
But
that
you still
happened
you still keep all your hair. But the good thing is that during pregnancy, you can look really good hair-wise.
Yeah. But here is an interesting point. I find that when I'm ill, my nails get long.
That's interesting, though.
When you're ill?
Yeah, once I'm
Yeah.
sick, my nails grow.
Maybe
you know,
because
if-
you don't cut them then.
No, they just grow. They grow quickly.
Okay.
Well, that can happen, but usually if you get really ill, you develop something called Bowes lines, where the nails get a line that's an interrupted line that shows you when you were sick. So it's a groove that occurs horizontally on your usually 10 nails, and it tells you this person was really ill. They may have been confined to bed or hospitalized for some time. Yeah.
Well, listen, let's go back to the hair dyes
Yeah.
because a viewer actually
Yes.
wanted to know about
Well-
that and how it really affects your scalp and if
Well,
it
it
can.
doesn't. Once you don't have an allergy, we talked about a hair dye allergy earlier in these programs. So once you don't have an allergy, you can dye your hair, you can relax it, you can do your usual hair treatment without any difficulty.
So it doesn't affect the scalp generally to the best of your knowledge.
Well, if you have, some people have an allergy to what's called PPD, which is a dye, which is an ingredient in hair dye, and that can cause really incredible swelling and itchiness and weeping of the scalp. So individuals who have that know it because it's very uncomfortable, in which case you'd have to use PPD-free dye. But usually nothing happens unless you have an allergy.
Okay, so then if you do have an allergy, you could get headaches and all kinds of other things,
Well,
flaking of the
it is
scalp.
possible, yeah, flaking of the scalp and other things. But most mothers are at an early age, except, well, it's not very common for ladies in the later years to have children now. So most pregnant women don't really need dye unless they're prematurely gray, or they just don't like their hair color.
Let me ask you though, do you find any of the newborn children coming along into this world with any of the conditions, skin conditions that the mother might have had?
Yeah, well, it is possible. There are some skin conditions that are passed on. We did talk about a form of lupus that the child can come out with the rash of lupus. We did mention the pemphigoid version of these dermatoses of pregnancy, where you can get the blisters in the child. But most of the changes in the children have to do with the hormonal influence while they're in the uterus, and you know, they can come up with acne, or they can have something called mylia, which are some little white bumps on the face. But since that influence is removed and the child is in its own environment, usually they all get better.
Oh, okay, so no long-lasting challenges with that.
Except it's genetic. Then if you have a mother who is atopic or has sensitivities in the environment, asthma, insect bites, whatever, your child may have one of those conditions later on. But luckily psoriasis isn't transferred. So children usually do pretty well once they're out of that environment.
Okay, you alluded to the fact that with one of the types of dermatoses we discussed today, stretch marks on the tummy can become inflamed.
Yes.
But is there anything that you can suggest to help with stretch marks, or are they kind of genetic in some cases?
Well, stretch marks you have to moisturize your abdomen a lot, and also it has to do with your weight gain, and most of the weight gain rapidly comes in the third trimester. So your doctor usually has a plan for you to gain weight, but some women put on too much weight, and if they go too quickly, and if their skin is such and kind of thin, then they will more get stretch marks. So it has a lot to do with how you manage your diet and your weight gain during pregnancy.
Could you do preventative maintenance on something like this? I mean, you know, during the process of pregnancy, if you could use whatever creams or whatever on that
Most
area?
Vitamin
people
E oil.
love cocoa butter. West Indians love cocoa butter and believe it has a lot of magical properties. But really and truly,
The doctor said magical.
Yeah, they should just drink cocoa. That would serve them better.
or coffee. But you know, the moisturizing is the main thing, and keeping the strength of the skin up. So gaining a lot of weight in pregnancy is never good, because it's linked to a lot of morbidity and other things, you know. So there's something called preeclampsia that occurs with pregnancy, and then there's hypertension. And we did mention that if you gain weight too much, then you can be prone to having the first dermatoses of pregnancy that we mentioned.
Right, okay. So do guys get stretch marks with their
guys,
their
there's something
bellies
called
as well?
physiological striae. So teenagers, guys can get it in the teenage years, and they're usually horizontal in the back. But girls more commonly get it, you know, as
What about bare bellies?
Well, most bare bellies don't get stretch marks.
Oh, it's over time.
They take time, yeah.
We were talking about pregnancy.
I was just
This may not be the appropriate question to ask, but there is a theory that, you know, men get sympathy pains. You know, do you get?
Really?
Well, there's some psychological connection between
you know, like
between
morning
couples.
sickness and so
yes,
on.
it is
That kind of-
possible. Some guys are like that, but it doesn't happen. Luckily, it doesn't happen very often.
Well, I'm just wondering, in this condition.
Luckily. Luckily.
I think it happened to Arnold once in a movie, though.
Oh, Arnold Schwarzenegger's. Okay. Thank you very much for sharing with us on this, and certainly we look forward to the next. What's the next big word that we won't be able to pronounce?
I think we had put back something called molluscum contagiosum, which is a simple viral infection. So that'll be very light and easy for the viewers to learn something about.
All right.
That's not by
Then we'll go back to
name.
something else.
Give me that name again.
Molluscum contagiosum.
Molluscum contagiosum.
Nice to you too.
That one's not too bad. Thank
Listen.
you, Dr. Ford.
Okay.
We're going to take a break and come back on this National Coffee Day with some standards. Yeah, that and more straight ahead on the Monday edition of Morning Barbados.